visual learner, you do much better seeing me talk and watching me just move my body and hair around than somebody who's just listening to a tape. So it's really important. So they tend to sit right at the front of the classroom. They don't want to have any visual obstructions. They want to be right there when you're learning. And they love diagrams, flip charts. They like handouts. They like little books and pocket charts, all those type things. Now, auditory learners, they just like to listen to a clear-cut lecture. That's how they are. And they love to sit and listen to other people and what they say. But they listen to pitch, to tone, to speed, and other things like that. So, tactile learners. And I'm going to have you do this. Last time we did this with the whole group, everybody was shocked at how they learned and how other people learned. And they were surprised at their own. So I'm going to have you score this, and you can look at it. And then I want you to meet with a person sitting next to you. And Susan will help facilitate that for you all that are in a group session. For you guys at home, I want you to really look at your preceptors that you've had in your life and how did they teach you more, and look at your own self, because and then as you tend to use that to precept other people, it's really important to know if you tend to do a certain style, and especially if the person is, if you're not teaching an auditory style and they're auditory, of how you need to compromise for that. Okay, and be aware of that. So tactile or kinesthetic learning, you move, you do it. That is what I am. If you come and tell me, this is how I program this pump, boom, 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 and visually I can see how you do it, doesn't work for me. I've got to do it myself. I've got to do it myself. And I just absolutely loved, I had a preceptor once who said, okay, this is what you need to do. You're an experienced nurse. You haven't used these pumps before. They're fairly self-explanatory. I'm going to have you do it first. And I really like that. The see one, do one, teach one works for most people, but for tactile learners, they just need to do it or they're not even going to absorb that initial content. So go ahead and do it, and they'll say push this button, and you've got to push it, and you've got to enter, and you can see how it works, and really good to get that feedback of the screen and all that yourself. And you'll see by the quiz, it's giving a map and a direction. And I love the story that Carol does when she developed that to evaluate you by giving somebody directions. Are you going to give them verbal directions because it's so good versus written directions versus, you know, something more visual, drawing a map. Okay, so remember that tactile learners can't really sit in a lecture. They can't really sit and listen to you talk on and on and on. Really difficult. Now, if you can combine some of these by letting them do something and talking, even letting them do part of touching the dressing when you're changing it. These are experienced nurses and adult learners. You guys really need to individualize and accelerate that. These adult learners might be doing dressing changes and might be way more experienced than you are at certain things and more up to date if they came from a big university or teaching or a resident hospital or whatever. So just be aware that adult learners, you've got to be flexible with them. Okay, then the last one is your reading and writing learners. They need words, so give them handouts. Now, I want you to apply this to your patients. Really important. What I did with students this year is I had them do this with their patients. I had students going into homes visiting elderly people, older adults in the community, and who had volunteered time to mentor young nursing students. And it worked out really great. But for teaching, they had to teach them about one of their meds or one of their treatments. And I had them do the learning style, and they were shocked at the different way, and they had to specifically cater their education to how the person learned. Well, haven't we done a really short because of Joint Commission? Oh, how do you learn? Okay, you like to read? Okay, here's a handout. You know, I think it's really important to look that not all people are handout people, and not all people need visual. So in that micromedics program now, which I absolutely love, they've got pictures of organs and bodies and all sorts of that in color that we can print off. And they also have handouts too with simple instructions, so that's nice. Just know there's a big variety of how to do that. So as I finish up now, and you guys go into more talks about your team collaborative, I want you to really value each other. And if you could today, during one of your discussions, I want you to go ahead and do the learning style survey quiz, tally it up, and figure what type of learner you are. Meet with the person that's next to you. I'd like, if possible, for you to meet just with 2 people and be able to talk about this. At the same time, I would like you to practice, and I'm hoping that you all have known each other a little bit. Practice saying something positive, what you really appreciate about each other, and what the person's strengths are, and maybe you have a story that's something that they did for you and that you really appreciated. So I'd like you to really process that positive feedback. And then the third thing I'd like you to do is talk about how you can care for yourself and how you can commit to care for yourself. Maybe in these partner groups that you're in, that you could even kind of work through email and set some goals for yourself. What are some health goals that you can do in the workplace to be healthier? Can you do some back stretches? Can you do good body mechanics? Can you really drink so much water a day and be hydrated and bring some good snacks to work? What can you do for yourself? And Susan, is there anything else that as we wrap up that you really think that you'd like them to work in the pairs of 2s?
I think that those 3 exercises will be really good.
Okay.
And no, this is excellent. Well,
okay. And I'm just really encouraging you to take care of yourself. And maybe the 4th one you could do, I'll put it in, is you can really talk about how can you create a team that you can fall back on. What are the negatives and what are the positives? What are things that are roadblocks that you need to get rid of that make the team not a safety net? How do you trust each other more? How can you connect and believe that you treat the person with ultimate respect and that you care about their health and well-being? And maybe you do a commitment to coworker, but how can you make the team, the collaborative team, a safety net? You're going to have lots of other activities for the rest of the day, so I really appreciate meeting you, and hopefully that we'll meet again in the future. Thanks.